So this is just a short video to show you how to use patient notes rather than task lists. And most of our clients have chosen to do this because it's a lot easier and faster and really more apparent about what's happening in here. So here's Donald Duck coming in today. If we go into his chart, we can see that somebody's already made a note that they've requested the x-rays from Doc Holliday, because Donald saw Doc Holliday recently. We want to get those x-rays. So I can just copy this note so I don't have to type it again. And now I'm going to do a patient note. I'm going to go up here to make an appointment, but instead of making an appointment, I'm going to make a patient note. You notice there's no treatment in there, and the patient's not going to get confirmed. So now I can paste my note that I already wrote in there, just so I don't have to type it again. I want to date stamp it, and now I can just say okay. I could change the time over here, but there's my appointment right there. And now I can drag it anywhere that I want, to any date that I want. Now, I've already done this. I've created an appointment out in the future. The problem is, I can't tell by looking at the paperless routing slip where that appointment is. I can see that it exists, but it doesn't have a date. But if I go up to my patient appointments and click on it and then go to the appointment, aha, there it is over there. And we suggest you put it in your notes column, but you can put it anywhere that you want. And again, I can drag this anywhere I want. I want to move it up, make it a little sooner. The other thing that I can do is when I have providers in here, it doesn't make any difference. It doesn't change the color or anything. So if I want to assign this to somebody, I'm going to assign this to Linda, and blue is her color. And now it's going to be very apparent to everyone in the office that this is Linda's job to do that. And when she got those x-rays, she can just set it complete, or she can delete the appointment. We'd rather set it complete. So hopefully this little short video is helpful.